There was something more, so it cannot just be a coincidence.
Just sad, or maybe I already have a depression.
Not to improvise.
Dr. Federico Cevoli is a mental health scientist, the mental health pillar coordinator at the Luxembourg Research Clinic, and the author of numerous scientific publications. Today he will explain innovative approaches to treatment, share his insights into the future of mental health care, and shed light on the links between mental health and brain health.
Researchers have tried to investigate whether depression could be a sign or a predisposition for later on the development of dementia.
How do you find this out?
A good question.
Federico, nice to see you.
Hello, hi, thank you for having me.
Could you tell us what is the most fascinating secret about the brain?
I believe what I find most fascinating is the fact that our brain itself is only 2% of our body's weight, yet it consumes up to 20% of our body's energy. We got our brain metabolisms that is responsible via energy production to our neurons, so our brain cells, activity, which in turn gives us what we're doing today, for example, talk, walk, and that is called functional connectivity. So let's imagine this like the thermostat of our house, where, for example, it regulates the temperature in all different rooms, and this is what our brain does.
Wow, that's really amazing. Great, thank you for this explanation. Our podcast is dedicated to the brain health, but you are, so to say, specialist on the mental health. Could you explain us a bit the difference between mental health and brain health? What do they have in common? What are the differences?
So let's break it down. So we always heard that exercise, physical exercise, sport, good diet are the fundamental basis for a good mental health. But what if there was something more to it? What if there was to be a biological link? So rather than going through definition of brain health and mental health, let's try together answer a question. Can a clinical depressive mind be biologically linked to a physical disorder, so a physical brain disease? Now, for years, researchers have tried to investigate whether depression could be a sign or a predisposition for later on the development of dementia. So let's look at the field of neuroscience. So what we see is that, let's follow the science, right? So what we see today is that researchers from the United States, together with the researchers in Denmark, they looked at what is called the Danish National Registry. And what they find is that, so they looked at 1.4 million data from patients from the registry, and what they find that out of this number, there were a group composed of about 240,000 people that were previously diagnosed with depression. And so what they found, it's a number. What they found is that the people with depression were 2.4 times more likely to develop dementia later on in life, even when the depression was diagnosed 20 years before the onset of the disease.
Wow.
So so we can understand there was something more, so it cannot just be a coincidence. But let's go further. Let's look at, for example, Parkinson. So studies have shown that, for example, in women in this instance, there's a negative correlation. What does it mean is that they've looked at the severity of the depression in women that have been diagnosed with Parkinson, and this correlates with the increase of cognitive deficiency. So that's really something beautiful that I'm pretty sure in the next year we'll see some amazing results from scientists all around the world. And last, there's been as well on the pharmacological level. So, and there was a great professor in Oxford University that has provided evidence looking at 25 years of data and biological work that was being carried out on this specific medication, and actually showed that, provided evidence for that this medication could actually slow down the progression of specific symptoms in dementia. And if we look as well at the field of cardiology, we can see that 2/3, so 2 out of 3 patients diagnosed with a major depressive disorders have cardiovascular diseases. So when we look at the evidence collectively, we can see that it's not just a coincidence, but there's really a connection between our brain health and our mental health.
Thank you. And you know, there are still a lot of people who don't believe in the existence of depression. So if we would like to give them evidences and to persuade them, how can we explain them? Where can we see in our body, if we compare a person who is totally healthy and someone who has a depression, where can we see in the body of this person who has depression that he really has this disease?
So the problem with today is that we associate an illness with something physical, for example, a broken bone or a heart surgery, for example, for a specific type of cardiovascular disease or for a tumor. However, the depression, especially at first, and can be invisible. However, when by the naked eye, we don't really see much of the difference. When we looked into our body, we can certainly see, for example, if we were to look at brain imaging, for instance, we could see there's a reduction of brain activity in the frontal part of our brain. We could see that, for example, we have elevated level of a stress hormones that's called cortisol, for example. And as well, we can start seeing some different patterns in our sleep. Indeed, we could start seeing a more fragmented, a more of less quality. So, and when we look at the behavior, so when we look at the physical behavior of that person, we could start see that over times you have lower, reduced facial expressions, reduced motivations, and so altogether, that's what gives the depression, the illness, as very multifactorial nature.
And if I, for example, I myself, I still didn't went to the doctor, but I feel a bit sad, how do I know if I'm just sad or maybe I already have a depression? What are the first signs?
Yeah, sure. So depression is not just a feeling. Depression is a biological cognitive and behavioral disease. So that means that it just doesn't go away overnight or over a week, because there are biochemical reactions that are taking place inside your body that makes your mind, your brain and mind sick.
Okay, so it means that if I feel sad for a longer time, it can be a sign of depression. That's it.
It's not. It's
not that simple.
It's not that simple. But if you believe that you might be impacted or might be feeling a longer sign. So, for example, differences in sleep patterns. So, if you feel like you suspect that you are depressed, please seek help from health professionals. They will be the best people to do the diagnosis with you.
Mm-hmm. And how do we notice if people around us maybe need help? If maybe they're depressed, how do we notice this is the point we can offer help? Or
so if you suspect that somebody of your next of kin is depressed, I would say to encourage them to seek professional help, and as well to always look at your national guideline. For example, here at Luxembourg, there's a platform that is made available that's called préventiondepression.lu, where it's very well explained with all the signs and what to do if you suspect either yourself or your next of kin as depression. And there's also platforms for prevention of suicide. So I always encourage not to improvise, always look up at what your government recommends you do, and as well all the numbers that they recommend you should call in case of either severe cases or as well more mild cases.
And I understand that depression is a serious illness and should be treated with medication, maybe with all these things. But can we, apart from that, can we also help ourselves in some way?
Absolutely. So treatment is only part of a journey for depression. You have psychotherapy. There is huge help in people undergoing treatment, and both should be complementary to one another. And as well, exercise. Exercise has been proven, and there are trials, clinical trial taking place in the Netherlands, for example, that they showed the benefits of exercise with clinically depressed patients, individuals. And as well, when we look at exercise, what is the evidence? Why it's beneficial is because of a neurotransmitter that we all heard about, that's called serotonin, right? And so the precursor, so what makes serotonin is an amino acid that is called tryptophan. So when you run, what your body does is that it utilizes the resources, the elements that go together with the tryptophan, so that your tryptophan becomes more available, and so and that's also why after a run, your body feel more calmer, more relaxed. It's because your body is producing more serotonin.
Great. You also mentioned in our previous conversation that depression has over 300 combinations of symptoms. How do you know which kind of symptoms, how to treat with what medication? How do you find this out?
Yeah, that's a very good question. So in order to answer that question, we need to understand a little bit how it works, the system today. So today in the clinical setting, you have your diagnosis is based on some classifications of signs and symptoms. Our symptomatology depends on a large number and combination of sign and symptoms. So it's not just a black and white type of assessment, but it's in addition to all the behavioral signs that you can see, the psychiatry see in patients, you also add to it the psychological, the cognitive, the biological aspect of the disease. And that's why today this disease is considered as very heterogeneous. It's just because it includes a lot of factors. So, and that's why researchers, when we look at the biology, for example, researchers are starting to say that depression may not just be one disease, but actually potentially many biological subgroup. Now, before we talked about, at the very beginning, we talked about ATP, our energy production. So researchers are starting to look at type of depression. That is because the compelling evidence that this type of the depression may actually be linked to inflammation. So inflammation, so what they did basically, they've looked at a certain population of patients with depression, but with a specific type of depression that does not respond to current treatment. And today, this is broadly defined as when a patient undergoes 2-cycle medication and has no response, it has no beneficial outcome to the patient. And so what happens is that you incur into something that's called treatment-resistant depression. And so what they've seen in this population of patients is that they have a low grade of inflammation. What it means is that, so let's remember what we talk about the house, our brain is a bit like the house thermostat. Imagine that your brain, so like I mentioned before, I said, imagine that your brain is like a house thermostat. And so let's imagine now that your thermostat is stacked at a temperature that is not too high to cause high inflammations and not at a normal level, but it's kind of in between. A question raises is that can we use anti-inflammatory medication to help this patient that are impacted by this specific population of patients that are impacted by treatment-resistant depression. And this is actually a study that is going to be conducted at the King's College, led by an extraordinary professor there.
But coming back to my question, so basically if you diagnosed with depression, is it right that you should be tested for 300 different variations?
I mean, the work is undergoing, and we can't, of course. I mean, today we just starting to discover all these different biological subtypes of depression, and only with the years to come that we will probably, with all as the disease gets less and less stigmatized, that we can really improve our assessment, our diagnosis assessment of depression. So the answer in the short term would be very, very complicated to actually give the right treatment to the right person when it comes to depression. But on a long term, as we see all these clinical trials happening, I'm certain that we will be able in the future to actually biologically group people based on the type of the depression, on the biological subgroup of the disease.
Great. Also, recently has been some information in the press that depression is connected to gut somehow. Can we get depression from eating something wrong?
Okay, so the quick answer is of course not. So there's a fascinating field of neuroscience that is called that looks at how our guts, our microbiome actually influence our brain. And what they've seen, and there's an hypothesis that our brain and gut actually communicate via the stress hormones. Now, it's not the drug that makes the poison, but it's the dose. In the sense that if you eat junk food, you once in a while, it's all right. You do not get depression. However, if you predispose your body to a constant diet that is of high sugar, high saturated fatty acids, and obviously you predispose your body to the development of several illnesses, including, of course, the depression.
And then what are the major reasons for depression, or major causes?
So, like I mentioned before, depression is multifactorial. So there's not one single cause that causes depression, but rather we can look at, for example, there's a genetic predisposition to depressions. There's stress and child trauma. There's environmental factors like as well pollutions, and as well, for example, social isolations. So it's very hard and complex disease, and that's why often is not given the right visibility and the right place.
So those are main common causes that you just mentioned.
Some of the factors leading to depression.
Maybe you can give us some explanation about what are now the recent developments in Luxembourg in the direction of improving the situation just in general, or depression treatment.
What happened is that we looked at recent data that has been published by the CNS here, and they released the data from 2024. And what we've seen is that astonishing number of 17.3%. And when we look at this number, 17.3%, it's really it's a really an alarming bell. And this as well, when we look at the economic at the economic value, this is represented 1.6 billion of euros that were lost.
Wow.
due to the depression. It's just because of the absence of the sick day.
Mm-hmm. Wow. And what do you think will be done in this area? How to improve the situation?
Yeah, sure. So we actually we just starting dialogue among colleagues here at the Luxembourg Research Clinics, involving a fantastic team of researchers, psychiatrists, psychologists and professors. We're trying to put in place a new comprehensive study that will help us on the long term to better characterize depression for our patient.
Great. Do you have some geographical data? In some countries there are less depression, some countries there are more depression. Is it somehow related to geography?
Okay, so for sure, geography plays an important role. We know that, for example, in Nordic country where you have less daylight, there's obviously an important differences in that. We know that daylight, sunlight helps with melatonin production, serotonin. We know that melatonin, for example, is very important for help fall asleep and as well the quality of sleep. And we know at the same time that sleep is very important in depression. So, but at the same time, we also need to think that it's not just about geographical, and it's not just about geographical or something to do with daylight, but as well about the country resources. Because, for example, in more developed countries, we have more resources, there are less stigmatization of the disease as compared to low or middle developed country.
Mm. Now we're coming to the last question. Do you have your favorite hack? How do you hack your brain into doing something you don't want to do?
I think that that's a very nice question, because I think that the trick I use, especially if I know I need to undergo like some extensive work or that takes, a lot of brain power, I do a lot of running.
Mm.
I believe that, it helps you clear up your brain, your mind, get you to have much clearer thoughts after the run. And I think, I would recommend everybody to go for a run, go for half an hour, 40 minutes run, and then see how, and then
you can do whatever you want with your brain.
Exactly. Exactly.
Okay, thank you so much for this nice interview.
Thank you very much. Thank you to you.